Hi, I'm Helena, Director of Operations for Unique Senior Care. Today I'm here with Jill. Jill, would you like to introduce yourself?
Thank you. Hi, I'm Jill. I'm the Senior Social Prescriber at Citizens Advice Solihull.
Great to see you today.
And you. Thank you for inviting me.
You're welcome. If you could just first explain to me what a social prescriber is and how you can help someone.
Yeah, certainly. And actually, that's just one of the names as well for the roles. So it can be a little bit confusing because different parts of the country call it a different thing. So it might be a social prescribing link worker, health coordinator. There's all sorts of things.
Yeah.
But the role is basically the same. So the best way that I describe it when I'm talking with patients is that I say that your GP is there to support you with anything that's medical. I'm here to support you, to assist you with what's important to you. What are your challenges? What are your priorities? What would make life better for you?
So a more holistic approach to people's well-being.
Totally. Yeah. Yeah.
So what kind of problems can somebody come to you with?
Basically, anything that is non-medical. And that could be anything from perhaps someone who's just been diagnosed with a long-term condition, perhaps someone who's caring for a loved one with a long-term condition. It could be someone who is feeling very isolated. Yeah. That could be because they've got mobility problems and they're predominantly housebound. It could be that they have recently retired, been used to going to work 5 days a week, and then all of a sudden it's, well, what am I going to do with all of these 7 days? What's out there? It might be someone who's new to the area. It could be people who have got financial challenges. Okay. It could be people who are worrying about, well, I need some help in the home, but I'm worried about how I'm going to pay for it. Where can I go to get that help? It could be perhaps someone who's concerned about employment. They've got mental health challenges. There's all sorts of reasons why referrals come to a social prescriber.
Thank you. So how would you decide what kind of activities and groups somebody might need?
The most important thing is actually speaking with the patient. And I work differently from a GP, where we all know that we have quite a restricted time with our GPs. Yes. But I have as long as that patient needs. So I can take the time to really listen to them, to get to know them, to understand, well, what's concerning them, what would make life easier for them. And I think that's the beauty of this role, is that we have the time to listen to patients.
So very person-centred in your...
Oh, totally.
So would you help somebody get started in the activities, and what kind of difficulties would you be able to support them with?
Yeah, certainly. So again, by getting to know them, we can find out whether they want to be, if you like, handheld, i.e., would they like me to perhaps meet them for the very first time that they access a particular service, or if actually they're more self-sufficient. Some patients say, Jill, all I need is to know where they're taking place, what time they are, how frequently they run, and the kind of support they offer, and I will contact them. A lot of patients say to me, oh, that sounds ideal for me. Could you ask them to contact me so that I can have a chat with them and learn a little bit more about it? With regards to actually accessing whatever that they're looking, group activity, again, it's understanding, well, do they have any mobility challenges? Do they have challenges with their hearing, their sight? What things does the organisation need to know about to be able to accommodate that particular person? Is it that they're no longer driving and they want to know contact details for perhaps local taxi firms or volunteer transport services, or even which buses, trains, etc., walking route to get to somewhere. So it's all about spending that time talking and finding out what the challenges are and what we can do to make sure that they are no longer challenges for people.
Yeah, so it's not just that A to B, it's everything around it to enable people to get there themselves and to participate.
Yeah, very much so. And I like to follow up as well with the patient. So, how did it go? Did you enjoy it? Did you find it easy to get there? Because it's important for me to get feedback about the services that I'm referring people to as well.
Absolutely. And you want to ensure that your patients are getting the outcomes that they want from your service.
Exactly. And also just to make sure that the organisations that I'm referring people to are able to deliver what they say they can deliver as well.
Yeah, great. So how would someone find a social prescriber near to them?
So most people will be able to access them through their GP surgery. Every social prescribing role is a little bit different. It depends whether the social prescriber is situated within the surgery, or like myself, because I work for Citizens Advice Solihull Borough, we deliver the social prescribing service for a number of GP surgeries within our area. So for my patients, they can either access it through the GP surgery, whether that's the GP or perhaps the surgery nurse, sometimes reception staff.
Yeah.
Or for our patients, they can also access the social prescribing service through our Citizens Advice Solihull Borough website, where there's an online referral form.
Great, thank you. So how long would you support somebody for to help them get the services that they need?
So typically it can be up to about 12 weeks. I always say to patients, that's not set in stone though.
Yeah.
Sometimes I have conversations with patients and I give them the information they require and they say, that's great, Jill, that's all I need, thank you very much. I don't need any follow-up from you. Yeah. I know how to contact you in the future if I need you. Others want and need more follow-up, more contact from me. So it is very much patient by patient, and it's not me that decides how long I support them for. I decide that with the patient.
Excellent, thank you. So is it confidential? Is everything private?
It is a confidential service that I offer. I explain to patients that I'm not going to be passing on any of their details to anyone unless they specifically ask me to do so. I also explain to them that we do keep the GP surgeries up to date as to what support we're providing. In my case, I actually produce something called a patient plan, which I share with the patient for reference so that they can refer to it to remind them as to what we've talked about, perhaps contact telephone numbers that I've given them. They've got it all in one place. And I share that with the GP surgery as well, so that the surgery have got an overview of the non-medical support that's being provided to their patients.
Okay. If somebody wants to contact you, Jill, what's the best way of them doing that?
So if someone wishes to speak with their local social prescriber, wherever they're based in the country, I would actually suggest that they contact their GP surgery in the first place to find out how to contact the social prescriber connected to that surgery. Here in Solihull, as I said earlier, I work for Citizens Advice Solihull Borough, and we deliver the social prescribing service for Solihull Rural Primary Care Network. And that covers the following surgeries. We've got Balsall Common, Meriden, Hampton in Arden, Arden Medical, and Dorridge surgeries. So if you'd like to speak with me, then you can either contact your local surgery, or you can go to the Citizens Advice Solihull Borough website, where you'll be able to find the online referral form. Or if you'd like to call the office, the telephone number is 0121 779 6707.
Thanks for joining us today, Jill. I'm sure that's going to be really useful for somebody that wants to tap into your services.
It's been a pleasure speaking with you. Thank you for asking me.